Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. TNF-alpha inhibitors. Coming to all the common points about TNF-alpha inhibitors. Adverse effects, infections, TB, invasive fungal infections, reactivation of hepatitis B, injection site reactions. Whichever TNF-alpha inhibitor is given via subcutaneous injection like etanercept, adalimumab. Infusion reactions. Only one TNF-alpha inhibitor is given IV infusion, that is infliximab. Increased risk of malignancies like lymphoma, non-melanoma, skin carcinoma. Increased risk of demyelinating diseases like multiple sclerosis. Anti-drug antibodies. Autoimmune hepatitis. Hepatitis B virus and autoimmune hepatitis. Anti-drug antibodies and autoimmune antibodies like anti-nuclear antibodies, anti-dsDNA antibodies. These antibodies are benign, rarely produces disease. Pancytopenia also very rare. Coming to common contraindications, hypersensitivity, avoid with live vaccination, family history of demyelinating diseases. As it increases risk of demyelinating diseases, active infections, as it increases risk of active infections, along with anakinra. Anakinra is a interleukin-1 receptor antagonist. Off-label uses for every TNF-alpha inhibitor is autoimmune connective tissue diseases like scleroderma, dermatomyositis, granulomatous diseases. TNF-alpha is primarily mediating granuloma formation. Now we are inhibiting that TNF-alpha, so we can use it for sarcoidosis, granuloma, annular, neutrophilic dermatosis like Behçet's pyoderma gangrenosum, and finally systemic vasculitis. Coming to a few points about etanercept. It is a fusion protein receptor having 100 times more affinity to TNF-alpha than TNF receptors. So it acts as an TNF receptor antagonist. Binds to both soluble and membrane-bound TNF, inhibiting soluble TNF-alpha and membrane-bound TNF-alpha. This inhibition or this binding is reversible and not stable, hence immunosuppression is very minimal when compared to infliximab. Hence, etanercept is safe and rarely develops TB. Administered as subcutaneous injection, 25 mg, 50 mg formulations are available. After giving subcutaneous injection, it reaches peak in 2 days. 58% is bioavailable. Plasma protein bound is nil. For biologics, they will break down into multiple amino acids by proteolysis. They themselves are proteins which freely roams in the plasma. So, plasma protein bound concept, metabolized in liver, excreted in renal, all these concepts are not there for biologics. T-half of 5 days. Won't cross blood-brain barrier, but crosses placenta and even found in breast milk. FDA-approved uses of TNF-alpha inhibitors, etanercept, chronic plaque psoriasis. Dosage is 50 mg twice weekly for 3 months. Then we will reduce the frequency to weekly once, 50 mg. In psoriatic arthritis also same dose, 50 mg once weekly. Infliximab used in chronic plaque psoriasis, psoriatic arthritis, same like etanercept. Only difference comes with adalimumab. It is used in hidradenitis suppurativa and psoriasis. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. Das vidania.